you and answer all your concerns. Is that okay?
Yeah, doctor.
So, Helen, at the outset, I would like to apologize that your case notes are not immediately available with us. But I would look into the matter that why this has happened so that this is not repeated in the future. Would that be okay for you?
Oh, that's great, doctor. I am really still upset because I thought you had just neglected me and I had landed up in such an emergency situation.
I am really sorry, Helen, that you feel this way, and our care has not matched with your expectations. But I assure you, we have initiated an incident reporting to see what went wrong, what we could have done better. And as soon as the report is ready, we will be sharing it with you and we'll be very honest about it.
Okay.
So Helen, can I ask you a few questions, little bit to know your background, and then we can discuss further?
Yeah, doctor.
So can you tell me what happened after you had gone?
Yeah, actually, doctor, as you must be knowing that this is my third pregnancy. I delivered vaginally after my son's C-section for breech delivery. And I was really worried actually. My son was not well, and since the labor has started, and he decided to come out. And it was a straightforward labor, straightforward delivery. And I went on this very same day back home to be with my ailing son. He was having some runny nose, cough, and fever. Suddenly, I just remember after 2 days of having some uneasiness, some body malaise. I don't remember what has exactly happened, and I reported to the hospital in a very bad condition. And I remember that I got out in this high dependency unit where there were this dressing on my tummy, and then there were these strips and all those things connection monitoring. I don't remember what exactly had happened. They said something like bug had infected me. I don't know from where the bug has come, doctor.
Surely, Helen, we will be definitely addressing all your concerns and really. Um, as you said, how was your pregnancy?
Yeah, everything was straightforward, doctor. Even my first, second, third pregnancy, all are straightforward. Only the second pregnancy was C-section because of breech.
Okay. So, did you have any fever or any sore throat or any aches in your muscles or legs?
I had this malaise and X when I went home. It could be because of my baby's infection. But what this bug is there, doctor? I don't understand where the bug had come. Because I remember that there was very dirty toilets in the hospital, and I definitely say that this has come up from those toilets.
Uh, I'm really sorry, Helen, that you have been feeling this way. I will. I'll be addressing you the concerns, and if you have any questions, please feel free to ask me. And anywhere, if you feel I'm not clear, please stop me then and there, and I'll be happy to explain it to you again.
Oh yeah, no worries, doctor.
So otherwise, you are fit. You have been fit and fine.
Yeah, I'm absolutely fit and fine.
And any allergies you have been having?
No, nothing, doctor, nothing.
Okay. And any medications?
No, as of now, I'm on medication, but apart from that, otherwise, no, nothing, nothing. I'm now on medication.
So any surgeries apart from the current surgery and the previous cesarean which
No,
you
no,
mentioned?
no.
Okay. Any family history of concern, any clots, cancers, or sugars?
No, I'm not diabetic, and I don't think there is any cancer history in family also.
Okay. And so, Helen, how is your support at home?
Yeah, I'm very well supported. My husband is always there.
Okay. And a few questions regarding your lifestyle, Helen. Do you smoke or take
No,
alcohol?
no, no,
Okay. And any reservations for blood transfusion if at all required?
no.
So, can I quickly examine you in the presence of a chaperone? My midwife would be taking your pulse, blood pressure, temperature. I would be happy.
Doctor, actually, I'm very fit. I can go home now. They had decided to discharge me, so you can just debrief me what had happened to me and how to go further.
Okay, Helen. When you had come to us after the delivery, since you were not feeling well, so probably and your probably they felt because your blood pressure was falling. I don't have the notes currently to be telling you the exact situation, but what I assume was they speculated that there could have been a collection of pus inside your tummy, and for this reasons, the blood investigations were taken for you, and you were taken immediately to the operation theater for the operation. Am I making myself clear?
Yeah, quite clear.
So
Yes.
although there was no blood found collection found inside your tummy, but the blood reports which were taken prior shows that a bug has been come out positive for you, what we call it as group A streptococci.
Okay, okay, okay,
and
okay.
and that would have caused maybe responsible for you getting so unwell and and being operated.
Okay, okay.
So going further, I would like to tell you, like this bug, usually what happens is, this is like a normally present on our skin, on our throat. But sometimes what happens is when the body's fighting capacity is reduced because of some stressful conditions, or if somebody is taking some steroids. So in that case, what happens is the bug is able to cause the infection. So that could have happened in your case, probably because of the stressful event of pregnancy going on. Am I making myself clear?
Okay, okay, okay. Yeah,
And
quite clear.
and it could have also been a possibility that since your son is not feeling well, there is a possibility, because this bug spreads usually by, either by sneezing, coughing, or even touching each other. So there is a possibility that it could have been spread uh, through him.
Okay, okay, okay. Got it, doctor. Got it.
Going further, we
Now
will.
I'm really scared, doctor. Again, if I go home, will it again? I will catch the same infection and I will be in the similar situation. I'm really afraid to go home now then.
Uh, Helen, I will be explaining it to you that as of when you go home, we will be continuing with your antibiotics, which has been offered, and your painkillers and the blood thinning agents as well. And when you go home, then we will offer you to stay in a separate room. Although your members who are taking care of you can enter your room, but they should maintain strict hygiene. Like they should wash their hands every time they enter. They should be using gloves and aprons and masks when they enter the room. And when you go home, a health visitor and the social worker and the community midwife would be making visits to you, and they would be seeing your dressings, and changing your dressings, and again it would be like covered very well, so that it doesn't spread anywhere. Am I making myself clear?
Yeah, quite clear, doctor. Okay.
Since this and when you are at home when taking care, I would of your children, I would just offer you to avoid sharing the utensils together, because as I said, this spreads from the droplets and by touch.
Okay, okay, okay. Okay, yeah, yeah,
so
definitely.
so since this is a this is a can have a life threatening life threatening, it can result in a life threatening situation. So we need to inform this to the infection control team. And also, like all the members of your family who are staying in your house would be screened, like samples would be taken to see that they do not have this infection.
Okay, okay. Yeah, doctor. Thank you, thank you. Yeah, quite
uh,
clear, quite clear.
and anytime when you are at home, if you feel that you or any of your family members feels that they are having sore throat, or they are having fever or aches in the muscles, then you should report to us immediately.
Okay, okay.
So I will be giving you the patient information leaflet, and also I will be informing your GP about this, so that your care is well maintained.
Okay, doctor.
Anything else you want me to address?
No, doctor. Thank you. Thank you for your time.
And I would be initiating the incident reporting as well, because of the readmission you had.
Oh, yeah. Thank you, doctor. Okay. So then, yeah, Rajni, your own reflection. We will ask and then we will discuss the answer key.
Uh, I don't know. I don't didn't know this station, so that is why I put it.
No, but actually, one should not be going without doing a Lisa book. That is
Okay.
a the Lisa is the very good book. Okay. And nowadays, what I have observed, whatever stations they are giving, most of them are from some or the other book.
Okay, ma'am.
Okay, so that's the reason we have decided to go ahead with the book initially. I told everyone to go through each and every topic, each and every book. Okay, very nicely done, but nicely done.
Okay, ma'am.
Okay, so what about others? Anybody wants to comment on this? No? Tired? Okay. Uh, so Rajni, the tone, introduction, uh, communication was very good from your side. There were hardly any points which I think was missed by you. Most of the points you had covered according to this task what I am having. Actually, I find it initially when you entered into the station, so I find that you were struggling how to start and from where to start. That starting point you were not getting, but then once you picked up that point, then you were very smooth throughout. Yes or no?
Ma'am, like I don't know notes because the notes were not available, so I wasn't sure whether I need to do instant reporting for this also. I was like lost.
Yeah. Yeah. So initially I thought you were struggling from where to start with, okay, the notes are not there, so let's ask this. And when, okay, we will ask and we will go. Most of the time, this might be a lay station. Okay. So always remember that whenever lay is there, your communication will be very, should be the always on a positive side. So whenever she says something about her family member, please ensure that you will ask, how is he now? And I was telling you, okay,
Okay.
because they are not interested in knowledge, they are interested in communication.
Yes, 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 ma'am.
Okay, so these are the clarification. Next step, whenever you, I will say something about my family member, the lay will definitely take a note of that mention point. Okay, so how is that patient? How is your son now? Okay,
Okay, yeah.
so in lay, always remember this. Your any family member, anything, if the role player is saying, take it as a something related to the lay and say something about that. Apart from that, everything was now normal. You, yes, you were confused actually because you don't know whether the discharge, and the discharge is also very scrap, dear. This discharge card is very scrap. Don't you think so? Okay,
Yes, ma'am.
what your FY2 has written is very scrap discharge card, but you are not going to say this to the patient. You can just say that, Helen, I am doctor looking after the patients. How are you feeling now? Are you ready to go home? This will be my introductory sentences. Are you ready to go home? Because the midwife has mentioned that you are fit to go, but I am aware that your case notes are not available. We will look into the matter, and yes, if it is not available, misplaced, we need to do a incident reporting. Why it has been misplaced? Okay, I correctly identified. I am aware now. My aim will be here. I am aware that you are going through a tough time and surgery after the delivery. I am here to explain you what exactly had happened to you and make proceed with discharge once formality is completed. Proceed with the discharge, because you know that the discharge is very crap discharge summary is there. Okay, so as at present I had not any case paper, so I will continue consultation by asking couple of questions, that is agenda setting. Okay, because I am not having, and any specific concern, I think infection was due to bad quality of toilet, that was my concern. So sorry if you are thinking toilets are dirty, I will report it to the cleaning department, and but they are not the reason for this infection. that one question which you need to identify. Okay, so if she's bleeding, okay, so I will make it sure that I will report that this toilets were not cleaned. Definitely I will report, but they were not the source of infection. So can you just tell me what had happened to you? So here also you must be remembering that I give it to you complete information. I don't want you to ask me so much in detail and go so much in detail, asking me the repeat question. So I went told you what this is my third pregnancy, second was sexy section, and I delivered vaginally. There wasn't any concern, everything was normal. And after that, going home and then again came coming with a collapse state. I am not aware what exactly had happened. So that completely, so I don't want you. Now there will be closed questions regarding my labor only. Apart from that, there won't be any closed questions. Someone debrief you what had happened? No, nobody has debriefed me. What about your baby? Are you breastfeeding? Yes, my baby is with my partner as of now. Since I was in admission, I may not be okay, or I will be, I am breastfeeding. Now the history will be to elicit the risk factor, what exactly had happened, and the source of contact. These are your two information gathering in this case. The IG will be risk factor, why she elicited. Okay, post pregnancy is one point where her immunity will be down, but any diabetes, any long term medication, any risk factor during labor, specifically BMI will be risk factor, PPROM. Okay, PPROM, anemia. So these are the risk factor what you are going to ask. This is the history regarding the risk factor. Even smoking, needle sharing, these are the risk factor when it comes to the risk factor for infection. Why? And the source of infection. Okay, means did you come in contact with someone? If she is not giving you history of any streptococcal infection, so did you come in contact with someone having sore throats or runny nose, then she might give you this information. But I had given you from the very beginning because I wanted to go home early. So you means you have to identify, okay, her son is a source of infection. How is he now? Is he been taken care by GP? Have you shown your son to the GP or something like that? You have to say, because that is communication with patient, and it will be definitely in lay marking. So now this is only information gathering here. Okay, how are you feeling? Have you started mobilizing, eating, drinking? And then the risk factor history, risk factor, and the source of infection. Okay, this is the only history. Allergy, yes, it is important in this case. What is the means whether there is any allergy, because you are going to give her continuous antibiotics. As you had a very bad infection by bug known as streptococci, and it had costed you your life, but due to timely surgery we could able to save you. When you present it to now you are going to create a scenario, because you know that from this scrap discharge card, at least you know that she had come with a infection, but you had decided, you thought of it is an internal bleeding and you decided to undergo laparotomy, but then there was pus, and you in means whatever the way of presentation, whatever your primary diagnosis, but the management, it was same. It was basically, since it was a pus which was growing inside your tummy, and removal of pus was important to save your life. So that one thing you need to explain to the role player. By doing a timely surgery, we could able to save your life by doing a timely surgery. Although we thought of it initially as internal bleeding, but after opening your tummy we find out there was a pus inside. We drained it, give a thorough wash, and closed the abdomen, and shifted to the high dependency unit, where you were treated with the help of antibiotics, which are baby friendly. You have to mention that they are safe during lactation. So we observed there for 2 days, and now since you have opened your bowel, bladder, and you are free of any concern, we are decided to discharge you. Okay, so the bug who has responsible is known as group A streptococcus, which is a most common bug which you had mentioned, but many a times it is associated with milder infection like skin, throat, but sometimes it can be a very severe and life threatening. So the source of infection was her kid. You have to explain her why she has cashed up this infection so severe. It could be because of the stress, post pregnancy, post delivery, could be the reason. Although there is no other risk factor in her case, so it could be because of her post delivery, post pregnancy, she is more prone for infection catching up. Okay, and it is not anybody's fault, whether it is not her son's fault, it is not her fault, and it is not the faulty toilet. So she should not blame anyone. She should not blame anyone. So that has been in the answer key actually. uh, am I going to be safe at home? Very because I was scared of going home. Very rightly you had mentioned, yeah, your concerns are valid because since you have catched up this infection, less likely there will be a repeat infection here onward. Since you are being on antibiotics, and if you are having any problem, you can, I will be providing you 24/7 contact details. Also will be writing to a GP and midwife to keep a continuous eye on your health, and they will inquire you by a midwife will visit you. So they will be inquiring and they will be keeping eye on you also, whether you are having any concern. And anything, anytime, if you think that your symptoms are coming back, do come back. Do come back. Now, the next thing will be any infection in your family. Yes, GP will be assessing them and they will be treating it. Regarding suture removal, report to the midwife or GP. They will be helping you to remove these sutures. I will be go through the records once available and discuss your care plan, and follow up will be write the discharge card in details. Okay, so I will be now here I am going to, you can see that the discharge card was written, or the discharge card was filled by my ST or FY2. He is a new person. I will rewrite the discharge card with details and follow-up instructions. So I will be doing it right away and arrange for the discharge now. Arrange for the discharge. Incident reporting was done or not, I will just see. And if not done, I will ensure that the incident reporting will be done in your case. And we will like to see you at a perineal clinic, and that time we will discuss with you regarding the safe contraception. As of now, you are not going to discuss, but once we will be seeing you in our perineal clinic, so we will be discussing contraception. Throughout this consultation, I have not involved the consultant because this is just a debriefing session where consultant need not be involved in the patient's care. So, but we had involved the other colleagues like GP, midwife, okay, even the midwife who will was there in the ward, okay, she has asked you to come and see, and even the FY2 who has not filled the discharge card, okay. So those will be the communication with colleague. In this case, it will not be consultant, and it will not be right that we need to involve the consultant. Once the patient, our aim is to identify the patient is stable, the serious thing has over now, and now she is fit to go home. So that much we know. So reassurance is important here. So we need to reassure that she has been treated for a life threatening condition and now she is fit to go, continue her antibiotics. She red flags, report to 24/7 contact details or to the GP, and incident reporting and whatever concern she is having, you just need to tell her. That much is needed. It's a very simple task, but since it is a sidey task, sometimes we might find it difficult to start and to continue the consultation. uh, Discharge card, definitely comment something regarding the discharge card, that the discharge card filled by FY2 is not appropriate. I will rewrite the discharge card with details and follow-up instructions. Okay, that's it. Any question, anything?
No, ma'am.
Am I audible?
Yes, ma'am.
Yes, ma'am.
Is it borderline or is it fail?